Research across the globe has proven that exercise for people living with cancer has huge benefits, both physically and emotionally. Staying active can increase the chances of survival, stop the cancer from returning again, and improve the chances of becoming cancer-free. A tailored exercise plan is as essential as radiotherapy, chemotherapy, and surgery. During treatment, exercise may help maintain physical strength, mental health, and well-being, as well as improving the side effects of other treatments, and ultimately have a positive impact on recovery. In the following video, we hear from people and their experiences of exercise during and after their treatment. We also hear from cancer specialists and clinicians on how exercise can improve both the physical and mental health of people living with cancer.
There's worldwide research that's profound to say that there's so many benefits to exercise when people are going through cancer treatment.
And I think the mental health benefits are so clear. Just you see such a difference in the patient.
You know, we know that patients who exercise do better, they have a better quality of life, and it can even help with cancer-related or treatment-related problems such as fatigue. So it can help to build up future energy reserves and actually make people feel more energised overall.
We have been advising for a long time, but certainly is now part of routine care, that patients undergoing our treatments for breast cancer really engage in exercise at the beginning. I mean, this really should be part of our initial consult. It's a very complicated discussion and might affect some women, such as fertility, the impact on their work, the impact on their home environment and caregiving, and of course the psychosocial aspects of what a diagnosis of breast cancer can mean. These consultations are often very long. You often need more than one of them. And then exercise really, I would argue, needs to come in really early.
It's amazing when you actually sit there and think about what you're doing, rather than sitting on the couch, get up and do something.
It's around educating and letting them know what's safe and what's best for them. And to realise that if they become tired, that's okay. You might not be the way you were pre-diagnosis.
The other thing I think we probably underplay is the importance that, particularly patients are a part of a family, a part of their community, and exercise is something that they can do with their friends and their family.
I was first diagnosed on the day of January the 11th, 2019. So I headed in and he gave me the news, and I spent the next 3 weeks trying to come to terms with the diagnosis and understand it and why it happened to me.
Atalante had what we call a triple negative breast cancer. So this is actually one of the rarer types of breast cancer.
Exercise can save your life. Can, not that it will, but exercise can save your life. Cancer is a diagnosis. It doesn't have to be the rest of your life. I had lots of people coming around with long faces and were quite surprised that I was constantly cheerful, laughing, looked extremely healthy. After seeing myself in that space, I realised that I can't stop this exercise. I have to keep doing it because it's what's keeping me feeling so well. The motivating factor for me to exercise was to live. I did not want to die. And what would help it was if I initiated some exercise and implemented that into the plan, which is exactly what I did. I think having someone to support you through an exercise program is crucial because you need someone by your side that you can laugh with, that you can work hard with, and who can push you through it. I met Kristen, who was running the session, and she played a video and told us the benefits of exercise. Treat exercise as part of your treatment. I heard those 3 words and I thought, I'm going to be okay. I'm actually going to be okay.
Sometimes we meet people after treatment, but the best time to exercise is when you're having cancer treatment. So I would meet someone and assess their capabilities and create an exercise plan that suits their needs. So it's really important to have 2 programs, a good day program and a bad day program, because when people are in treatment, whether it be chemotherapy, radiotherapy, hormone treatment, there's fluctuations in people's symptoms, and The guidelines say that you should be exercising most days. So, a bad day doesn't mean a bad week, and a bad week doesn't mean a bad month. So you need to sort of have a plan to cover all bases. So with Atalante's case, we sort of had a program that was, quite low level for the days that she felt unwell. And then she had a higher level program on good days where she felt she could push herself and really exceed those levels. Lots of patients tell me that they feel empowered when they're exercising. It's something that they can do for themselves that's positive in a time that, they might be having some negative feelings and it's quite scary.
No matter what your level of fitness, you can always find some kind of physical activity to help improve on that fitness and make you more able to adapt to the challenges ahead.
We know that exercise does so many fabulous things. And this is well known to the community, but I think particularly in the setting of a cancer diagnosis, there may be some hesitancy from patients or their families as to whether this is a safe thing to do.
Everybody's disease is different, but also every person is an individual person. So you have to kind of tailor it to each patient and make sure they feel comfortable.
So there's different avenues that people get referred to the exercise professionals, so myself as a physio and the exercise physiologists. But the best place to sort of get information is from the training team, or even looking at our website and seeing how they can get in touch with our team.
For patients who have never exercised or really don't know how to begin exercising, it's important for them to realise that it's never too late to start. It's all about building on the foundation that you have and slowly developing, or even if it's just maintaining the fitness that you have, that's really important as well. And we do expect a lot of patients with cancer to do very well in the long term. So not only are we focusing on treating someone's cancer, but we really want them to live longer and we want them to live better. And exercise is an important part of that.
2019, glands came up on the side of my neck. No signs or symptoms other than that. Got it tested and stage 4 prostate. From first diagnosis, first round of chemo, the advice was rest, pretty much eat what you like. And then the second round of chemo, there became a shift, and I saw in the lift there was just a pamphlet on exercise and, during cancer treatment. The difference was I went back to work and I got 18 months reprieve after that next round of chemo with the exercise, change of diet. The benefits for me between the two, just having a comparison was quite remarkable. But exercise is one of those things where you can actually take back some of the control over the outcomes.
Back in January 2020, I was feeling very tired, very lethargic, had a fair bit of weight loss. So I went to the GP, obviously had some blood tests done, and he came back with the news about 3 days later that I had acute myeloid leukemia. So I was rushed into the O&J centre. It all happened very, very quickly. Having a stem cell transplant, the hugest thing that you suffer from is fatigue. And that's the thing you've got to overcome. Basically what I did was I just got on the treadmill every day. That was the first thing I did, got out of bed, had my breakfast, got on the treadmill just to make sure I was moving. That was probably the most important thing to me because I knew if I stopped, I wouldn't get back into it. It kept me motivated and probably helped me tolerate the chemotherapy a bit. I tolerated the chemotherapy very well.
Exercise made me feel empowered because I knew that I could do something to help myself. And as a woman coming from an environment where I've always looked after myself, I've always done things for myself and being quite independent, when you're diagnosed with cancer, you almost lose your identity as a human. So what made me overcome that obstacle was take back some power and physically put it into my body through exercise.
So in my opinion, exercise helps people do the things that they enjoy in life and live their best life, regardless of having a cancer diagnosis.
I think exercise has really helped me out a lot. There's been periods where I've dropped off and I've really noticed a difference. So I think if I can tell that story to someone and pass that knowledge on, I think that would be a really great help to them.
I think it's really important that they see that they still have action and they still have power, and they're not a cancer patient. They're a person who can still move and live and feel good.
I know that exercise will keep cancer at bay, and it's a lifestyle choice, but also a survival choice.
What we have seen over the last at least decade, but probably a few decades now, is that exercise in the setting of a diagnosis of cancer improves your survival. And anything we can do that not only helps the patient live better, but lives longer is important. So we see this as a therapy that hopes to make them feel better. We know that it makes them live longer, and we hope it makes their experience of this diagnosis and potentially their tolerance to treatment over what may be many years more tolerable. So, there's really no downsides of this. The hardest thing is being able to fit it in, and that's our job, is to try and make this doable for patients over the long term.